So hi there to all Cancer De Novo followers. Today I would like to give you a brief explanation about biosimilars. Now, biosimilars, this term is heard more and more in the field of oncology, cancer treatment, and many people actually do not understand what biosimilars are. Even some doctors think that when we talk about biosimilars, we talk about generic drugs. So I would like to make things a bit more clear. So when we talk about a biosimilar, actually it's a copy of an original drug. So the patent for the original drug was expired, and then different companies are allowed to make this drug as well. But due to the fact that this drug or cancer drug has quite a big molecule and is produced in live cells such as bacteria, we cannot make it identical to the original drug, and therefore the name biosimilar. Now, it is important to know that when producing biosimilars, the preclinical studies are very crucial to do as much as possible in terms of testings and experiments to make sure that we are actually getting a very similar drug to the original drug. And then the next step would be a clinical trial. Usually we call it an equivalence trial, where they compare the original drug with the biosimilar in a specific disease area. And in those trials, the most important thing is to actually check the efficacy of the drug. Is it as effective as the original drug? And also the aspect of side effects. So we want to obviously know that the drug does not have more side effects than the original drug, and the side effects are acceptable. The first question that actually pops up in our minds is, why do we need biosimilars? If we have the original drug, why we need to make a copy that is actually very similar to the original drug? So there are a variety of reasons why biosimilar are emerging more and more in the field of cancer treatment. One of those reasons, obviously, is the cost issue. Now, biosimilars are usually much cheaper than the original drugs, and therefore you would assume that the access to cancer drugs with biosimilars will be bigger, especially in developing countries, third world countries, where they do not have access to cancer drugs, and sometimes due to the cost issue. So this can give them better access to cancer treatments. Also, if you go, let's say, in a country where they have a specific healthcare basket with a specific budget, and some of the drugs would be biosimilars, and therefore they would have more budget because they're paying less for the biosimilar drugs, and then they could introduce more and newer drugs into their healthcare basket without increasing their budget. So these are actually two main reasons for the production of biosimilars. And to be honest, many companies are interested in producing biosimilars because obviously it's also a nice profit for the pharmaceutical companies. And here we have to be careful. So I would like to talk to you about a critical point, which is the ethical point when it comes to conducting trials with biosimilars. Now, when we conduct a trial with a biosimilar, as mentioned before, we call them usually equivalence trials. So we want to see if the biosimilar is equivalent to the original drug. Now, you would ask yourself, why would a patient participate in such a trial when there's already an original drug and its efficacy is known? It's actually a very good question. And therefore, most of the trials that are conducted testing biosimilars are done in countries where also the original drug is not available for cancer patients. So by participating in the clinical trial, the cancer patient has access to the drug that he actually wouldn't have access to if he wasn't on the clinical trial. That's one thing, one issue. So it would be a bit an ethical problem when you conduct clinical trials testing biosimilars in developed countries where actually the originator drug is available for patients and patients do not pay any extras to get the original drug. And there is quite a big challenge in conducting those trials, and I think we have to be also very careful when it comes to ethics and biosimilar clinical trials. So in summary, biosimilars are very similar drugs to the original drug, but they're not completely identical because they are produced in live cells and therefore they cannot be called generics. Those drugs are introduced more and more into oncology. One of the main reasons is the cost issue. They could substantially reduce healthcare spendings in different countries around the world, but we need to always consider the ethical issues when it comes to conducting clinical trials with biosimilars, and obviously we have to wait for real-world data that is actually coming out year by year regarding the use and the safety of biosimilars around the world. We're always happy to answer any questions that you have regarding biosimilars, and please do keep following our blog at cancerdenovo.com. Thank you very much.